All right, guys, as always, I want to keep you up to date with the latest scoliosis research. And recent scoliosis research has been focusing on several key areas, aiming to improve our diagnosis, our treatment, and even our overall understanding of scoliosis. So one prominent area is the investigation into genetic factors contributing to especially idiopathic scoliosis. Studies are exploring specific genes and genetic markers that might predispose individuals to developing scoliosis, which helps us because it could lead to earlier detection and obviously a more personalized early treatment plan to avoid more radical approaches like surgery. Another significant research trend is the evaluation of non-surgical treatments, particularly in adolescents or teenagers with idiopathic scoliosis, which is exactly what we do. Studies are examining the effectiveness of various bracing techniques such as our ScoliBrace and scoliosis-specific exercises like our ScoliBalance and Schroth methods. Research is focusing on long-term outcomes of these treatments, their impact on curve progression and their effects on patients' quality of life. For instance, recent research published by ScoliCare explored the impact of ScoliBalance and ScoliBrace treatment on trunk muscle endurance in patients with idiopathic scoliosis. It's one of the downfalls that we hear from a lot of providers is that bracing might cause muscle atrophy. There's also growing interest in understanding the natural history of scoliosis and identifying factors that actually predict curve progression. And this research helps clinicians determine which patients are at higher risk for scoliosis worsening and who might benefit the most from early interventions like ScoliBalance and ScoliBrace. Studies are looking at factors like age, curve magnitude, skeletal maturity, gender to develop more accurate prediction models. And in the realm of surgical interventions, research is focusing on improving surgical techniques and technologies to minimize complications during surgery and after. This includes studies on newer spinal fusion procedures, less invasive surgical options, and even the use of more intense imaging and navigation systems during surgery. Researchers are also investigating the long-term effects of surgery on patients' physical and psychological well-being. And this is important to understand because there are long-term implications to surgery. Additionally, there's research and dedication to understanding the psychosocial aspects of living with scoliosis, studies exploring emotional and social challenges faced by individuals with scoliosis, and how these challenges have an impact on their mental health and their self-esteem. And research is highlighting the importance of providing support and addressing these emotional needs of scoliosis patients. So be sure to check out ScoliConnect, which is our online Facebook group. And finally, systemic reviews and meta-analysis are being conducted to synthesize existing research and provide evidence-based recommendations for clinical practices like ours. These reviews help us evaluate the effectiveness of different types of treatments and identify areas where more research is needed. For example, research is examining the impact of scoliosis on pregnancy in women with idiopathic scoliosis, which is crucial for understanding long-term effects of how your scoliosis progresses going through multiple pregnancies. And these ongoing efforts in research are continually advancing the field of scoliosis care, and ScoliCare is committed to using research to improve the outcomes and results of all of our patients with scoliosis.